Good day and welcome to our training on Emergency Obstetric Care for Prime Care Nursing Practice. In the previous video, we explained the critical, major, and subtle maternal danger signs that indicate a woman is rapidly deteriorating during or after pregnancy. We understood how to implement an immediate response pattern to safely stabilize the patient, summon assistance, and prepare for emergency escalation. We defined MEOWs and ISBAR as key tools for early risk detection and structured clinical communication. By the end of this session, the participants will be able to 1. Differentiate primary survey from secondary survey and begin appropriate emergency actions within scope of practice. 2. Communicate findings clearly using ISBAR while maintaining professionalism, privacy, dignity, and teamwork during emergency assessment. We will start by looking at the difference between the primary survey and the secondary survey. Think of it as a two-step process. The primary survey is your first rapid assessment. Its sole purpose is to identify and manage life-threatening problems immediately. This is exactly where the ABCD approach comes into play. The secondary survey, on the other hand, is a more complete assessment done after the woman has been stabilized. To put it in the simplest terms, the primary survey asks, "What can kill her right now?" While the secondary survey asks, "What else do we need to know once she is stable enough?" Let's look at what each one involves. First, the primary survey. This is where we focus on urgent, life-saving priorities. We're looking for things like airway obstructions, severe bleeding, respiratory failure, shock, convulsions, or collapse. Then we move to the secondary survey. This may include fuller history, obstetric history, physical examination, abdominal assessment, fetal assessment where appropriate, laboratory review, urinalysis, and review of medications and risk factors. Here is a vital note to remember. A full assessment is important, but it must come in the right order. Stabilization always comes before the detailed review. Now we will look at what ISBAR is and how it is used during handover and escalation. ISBAR is a structured communication tool used to give clear and organized clinical handover, especially during emergencies. It helps ensure that important information is not forgotten when calling for help, escalating care, or handing over to another team member. So, what does ISBAR actually stand for? Let's break it down. Identify. Start by saying who you are, your role, your unit, and exactly who the patient is. Situation. State the immediate problem clearly. Background. Provide the relevant history or context. Assessment. Explain your clinical findings. Recommendation. This is where you say what you think needs to happen next. And finally, read back or response. Confirm the plan so everyone is clear about the next step. To see how this works in the real world, let's look at a quick obstetric example. Imagine a nurse calling a senior clinician. Identify. This is Nurse Arter from the Maternity Emergency Unit. I'm calling about Mrs. K, a 32-year-old woman at 34 weeks. Situation. She has heavy vaginal bleeding and is becoming very weak. Background. She arrived 15 minutes ago. No clear antenatal records are available. Assessment. Her pulse is 124. Blood pressure is 85/50. Her skin is cold, and the bleeding is ongoing. Recommendation. Please review her immediately. We have started oxygen and IV access, but we need urgent senior support. Read back or response. You will come immediately while we continue resuscitation and prepare blood and theater review. Here is an important takeaway. Good emergency communication is a clinical skill. ISBAR helps turn rushed handover into safe and organized communication. We have come to the end of this session. In summary, we explained the priority of the primary survey for life-saving stabilization over the detailed secondary survey. We understood that effective triage requires combining clinical skill with documentation, teamwork, and respect for maternal dignity. Thanks for watching. See you in the next session. Bye for now.